Oh, I forgot. Yes. Okay. So I originally had a class scheduled on Tuesday, and then I got a call from somebody, Dr. Berry, I think, said, hey, you can't do that. We've scheduled a meeting for these people on Tuesday afternoon. I said, oh, no. What are we going to do? And she said, oh, all right. I'll move their meeting till 2:30, and you can have from 1 to 2. So, just to make things more complicated, I forgot this. Thank you. There will be a lecture from 1 to 2 by Dr. Fernandez on the upper extremity, the arm, shoulder and arm, which, in previous years was done in the last section, along with the abdomen. Makes absolutely no sense. Okay, so we're going to do a lecture on the upper extremity on Tuesday from 1 to 2. Then you have to go over and do something else somewhere else. When you come in on Wednesday, there will be a prosection. So Peter is going to dissect out the arms on 2 cadavers. So 2 of you will be surprised. One will be just a superficial dissection. He'll pull the skin off so that you can see the superficial veins and the nerves to sort of see what it looks like just under the skin. The other one will be a deeper dissection in which he will dissect out the major muscle groups of the upper extremity so that you know roughly what the flexors and extensors and hand muscles look like. And he will just demonstrate that to you one group at a time, sometime over the next couple of weeks. So that material will be there. You don't have to dissect it, but during the labs over the next couple of weeks, he will go to, or one of us will go to a table and say, okay, come on over and let me show you the upper extremity so that you know it. And there will be a question or two on it in the exam. But you don't have to dissect it out. But this material will be shown to you because I've been led to believe it's on your boards. And it's good to know how, you say you've done a human anatomy dissection course, but we forgot about the arms and legs. So you will have some vague familiarity when someone, talks about their brachioradialis or something like that. And then you will also know where you take pulses and where, venous blood is taken. Yes, ma'am?
When you say that there will be a question on the exam, do you mean it might be pinnable or it's just strictly written?
Yes.
So we have one on Monday,
Both.
Tuesday, Wednesday. Wait, what?
Yes, the final exam is cumulative, so everything's fair game then. And a little bit of arm will be probably on this exam. Then we probably will do leg sometime during the last bit. The same thing. I mean, we don't ask you to spend a day dissecting these. I mean, a day or as many courses would do a week and a half dissecting these areas, but we want to give you some familiarity with that. Because everyone came up to me last exam and said, hey, do we have to know all these questions on the arm that were on last year's abdomen exam? And the answer is you didn't, but their time will come. Okay? So it's going to be a little chaotic the next week. There are lots of sort of things being thrown in, but the number of formal classes is going to be fairly limited, so you can sort of fit it into whatever your other scheduled priorities happen to be. Okay, so this lecture is going to start out with some areas that we've sort of skirted. The orbit, we've talked about lots of bones contributing to the orbit, but we haven't discussed the orbit as an orbit. Paranasal sinuses, which we've sort of seen bits and pieces of them, but we're going to actually see them as a group and discuss them. This pterygopalatine fossa, I will show some slides and talk about it. I don't expect you to really understand it. We'll do this again when we get to the infratemporal area, and we will come back to it yet again. It's not as difficult as it's presented with all these fancy screwball names, but we'll make another shot at it. And then incisive fossae, and then the carotid canal. We haven't much talked about how the internal carotid gets into the brain case. And it's fairly straightforward, but it's something we haven't addressed to any great degree. Okay, orbit. Everyone knows what the orbit is, right? There's one on each side of your head, and your eyeball sits in there, along with a whole bunch of muscles wrapping around it that enable you to move it in different directions. So here are the bones that contribute to the rim of the orbit, the outside part of the orbit, the edge. Okay, so there's a zygomatic, cheekbone over here, the maxilla over here, and then the frontal on top. So the parts of these bones, needless to say, are sort of labeled in different ways according to what they're doing. For example, this is the frontal bone, and the part that's forming part of the orbit, the surface of the orbit, is called the orbital plate of the frontal. Likewise, the zygomatic is sitting over here, and so the part that's lying in the orbit is called the orbital surface, orbital plate of the zygomatic. The maxilla is sitting over here, and it contributes part that's the orbital surface of the maxilla. And then on the inside here, there's some other bones that we saw in the first lecture. The lacrimal bone here, so that you have this nasolacrimal duct and canal that's enabling tears to come from the medial side of the orbit. So this canal and duct is formed by the lacrimal in back and the maxilla in front, and then there's a tube that goes down into the nose. Still on the medial wall over here, there's the orbital plate of the ethmoid bone. Right? The ethmoid's lying here between the two orbits. So part of it's shown appears on this orbit, and the other one appears on the other side. Way back here in the back, there's a big exposure of the sphenoid bone. The greater wing of the sphenoid forms this posterior part of the orbit with a variety of openings that, well, we'll label in a few minutes. Okay, and then peeking up from the bottom, way back here, just behind the maxilla, is a little bit of the palatine bone. You have to look real hard, but if you look way in the back, you see there's a little bitty bit of palatine in there. So all of these bones contribute in some way to the bony surface of the orbit. Okay, so what are some of these holes that I talked about back in here, particularly in the sphenoid? There's this big gap up here, which we talked about when we looked at the sphenoid from the back, which is the superior orbital fissure. And later on, you will learn what nerves and vessels may pass through there, going from the back into the orbit. This is the optic canal. That's where the optic nerve, the second cranial nerve, comes into the orbit, comes from the brain into the orbit. And down here is another opening, a gap between these bones known as the inferior orbital fissure. And lying on the surface, sometimes on the surface of the maxilla, sometimes there's actually a tube, it varies from person to person, is the infraorbital groove and or infraorbital canal. And so there's nerves and arteries and veins that pass from back behind the orbit through this either groove, usually it's covered over by bone, so it's an infraorbital canal, and come out the front of the cheek over here in the infraorbital foramen. Okay? Over here on this side, like I said, this is the fossa for the lacrimal sac, and that's the posterior lacrimal crest, and then on the maxillas there's the anterior lacrimal crest, and then there's a tube, the nasolacrimal canal, going from the medial part of the orbit down into the nasal region. And back up here in the corner of the orbit, there's usually a little depression covering all these bones, and you will learn that when we dissect out the orbit, that's where the lacrimal gland lies. And that's the thing that produces tears. So the tears get produced over here, travel over your eyeball, and then go from here down into your nose. Okay, that was the orbit. Paranasal sinuses. Most everybody knows about paranasal sinuses because at some point you've gotten a cold and you feel like your head's going to swell up or something, and they say, oh, you've got a problem with your sinuses. Your sinuses are infected or they're clogged or something like that. So, before we show you what they look like, sinuses are just air spaces within the bones surrounding the nose. People have been trying to figure out for centuries why in the world you have them, and there's all sorts of crazy theories about why we have sinuses. You know, when people who have colds and sinusitis and sinus infections think, yes, why would you possibly have all these empty spaces just to cause you problems and make you sick? Which is a good question. It's been argued that they serve air conditioning, they can cool the skull, that they can change the pressures that is going on. It's been argued for many animals that they just reduce the weight of the skull. If you happen to ever look at an elephant skull, you find that most of it is in fact air. With these huge frontals, it's just like a honeycomb. It's mostly air, because if that thing was solid bone, it would weigh about as much as the rest of the elephant. So sinuses, clearly, if you replace bone with an empty space, it reduces the space of your skull. Some people have argued it serves as insulation for heat. So if the sun's beating down on your skull, you don't have bone transmitting that heat from the outside to the inside of your body. You put insulation, like air, between the outside and the inside. There are people who've argued, oh, it makes your skull float. Should you be trying to swim in the water? Maybe. Wouldn't want to try it. Others arguing, well, if you've got more air around your nose, that's more air that can be used for detecting scents. There's sort of problems with that, because the part of the epithelium that in your nose that actually detects the scents is a remarkably small bit in the back. The rest of it's just sitting out there, not being picked up by your first cranial nerve. Some people have argued that it adds to rigidity, that you can just put the struts where you need them, as opposed to having a solid structure. You put a sinus here because you need structural support in one place, you need structural support in the other place, you don't need it in the middle, so you just get rid of it. And then there's no question that anyone who's ever had a cold or talked to or heard somebody who has a cold, that the presence or absence of sinuses greatly affects how your voice sounds. In fact, there are lots of animals that have loud calls, and they have just big throat sacs that do the same thing, that they resonate the sound. And certainly the empty spaces in your head resonate the sound that's produced in your throat and mouth, and changes how your voice sounds. Okay, so that's what they may or may not be good for. Let's look more at what they look like. Okay, so here's, if you're looking at a half of a skull, we talked about this the other day. Here's the nasal septum. There's a cartilaginous part up front, and in the back there's two bony plates. The lower part coming from the vomer bone, the upper part, the plate of the nasal plate, the septal part of the ethmoid bone. If you rip this away and look at the side walls of this right nasal cavity, there are all these nasal conchae, right? There's the superior concha up here, the middle concha here coming from the ethmoid bone, then this inferior concha there. But you see there are various little holes throughout here. And the paranasal sinuses, coming in various different directions, come in from holes in the bones outside they all empty into the nasal cavity. So all these sinuses are lined with epithelium, so they can produce mucus. And if they're producing far more mucus than you have any use for, or even regardless, the mucus drains into the nasal cavity at some point. As you know, when you have sinus problems, there's endless mucus rolling through your nose that you're trying to get rid of. Okay, so here's a few more labels on these structures. Again, the ethmoid bone with these two concha, a little bit of lacrimal bone in there, maxilla there, inferior nasal, sphenoid bone here, palatine bone under there. We've seen all these bones before. More of the same, showing you more parts of the sphenoid here. So here's the sphenoid air sinus there. Right, this is that sphenopalatine foramen that we'll come back to a little bit later. We haven't seen much of the palatine, so here you see there's the horizontal plate down here, and then the part that's going vertical, which is known as the perpendicular plate of the palatine. And there's this hole that's partly surrounded by palatine bone, partly surrounded by sphenoid bone. So it gets the combined name of sphenopalatine foramen. And then the medial and lateral pterygoid plates, the pterygoid hamulus out here. The sphenoid sinus, which is lying literally right in the middle of this sphenoid bone, okay, empties into this upper part of the nasal cavity. So that's the opening of the sphenoid sinus. So any mucus coming out of the sphenoid sinus travels through that opening. Any air coming into the sphenoid sinus travels through that opening. Okay, so there's where the opening of the sphenoid sinus, there's that pterygopalatine fossa. Here's these, that looks like the same slide again. What did I do? Okay, so all of them, as I said, open into the nasal cavity. Okay, there are 4 pairs, although you might not realize it. There is a left and right maxillary sinus. They're in the maxilla. That makes sense because you got a right maxilla over here and a left maxilla over there. You've got a right and left ethmoid sinuses in the ethmoid. Although ethmoid's a midline structure, it has a right and left side. You have right and left frontal sinuses, one right here and one right here. And then, even though that sphenoid sinus looks like a midline structure, it has right and left sides to it. In fact, the right and left sides are generally separated. So you have a right and left sphenoid sinus, even though the whole combined together, they look like just a single cavity from the outside. Okay, so there are 4 places where we have these paranasal sinuses, and each one has a right and left half, and each one has an opening from the right and left sides going into the right or left nasal cavity. Here's what they look like, if you can see through the skin of this smiling fellow. So your frontal sinuses are right here, just above the orbits, in the front part of the frontal. They vary dramatically in size. Sometimes they're tiny, sometimes they're huge. Your ethmoid sinuses are sitting in the ethmoid bone right there. And your maxillary sinuses, are right behind your cheek in here. Looking from the side, so this is what the frontal sinuses look like inside view. This is what the maxillary sinuses look like inside view, sort of. And the sphenoid is way back here, right? About halfway between your eyes and ears, in the middle of the cranial